Good evening, everyone, and welcome to World of Women podcast through Zita's Healthy Beginnings. And this podcast is made available to us by the World of Ability podcast in collaboration with Transform You Network. We're always grateful for the opportunity. This evening, we have a wonderful friend of mine. We work together at the county, and we really pretty much have an idea of what goes on in our community. And I'm glad to bring her to help us unpack this issue we're going to be talking about today. As we all know, February is the month of love. February is the month where it's not that you don't have love in other months, but this is a designated month to celebrate love, Valentine, and stuff like that. And we are very grateful that also this month we are remembering women's heart health. And that's why we encourage people to wear red, just to remember that. So before we get into the topic of this evening, I want to introduce you to Lorraine Starsky. Lorraine is an RN, and she graduated from University of Pittsburgh School of Nursing, summa cum laude. She worked nearly 20 years as a public health nurse for the Allegheny County Health Department in Pittsburgh, Pennsylvania. Now you understand what I mean. Her work focused on health equity and addressing the social determinants of health. She has a particular interest in women's health concerns, especially how heart disease affects women. After retiring from the Allegheny County Health Department, Ms. Starsky began working as a nurse consultant, educator for Project Destiny, which is a social services agency devoted to assisting marginalized population. She is also employed as a community vaccinator for University of Pittsburgh Medical Center. Lorraine is not going to leave the public. That is her domain, in case you're wondering. And she has that passion for the marginalized, and she lives that every single day. I am a witness. So I am very privileged to introduce you to my friend, Lorraine. Lorraine, please, over to you.
Okay. Well, thank you for that introduction. And yes, I am, my kids always say, Mom, why you're retired? Why are you doing all this? I can't help it. It's like, I have to do it. It's like, to me, it's like breathing. I have to be involved. I'm particularly concerned about people who have trouble accessing our health system and getting the health care they need. So, I'm probably going to do that until they throw dirt in my face. Anyway, I am not so good at the technology. So I have slides that I'd like to share, but I'm not quite sure how to go about that. So if anyone can give me some guidance on that. I think I put them up on my desktop, so I'm not quite sure how to proceed. So if someone can guide me, I'd appreciate it.
Emily, are you available? Is Emily available? So if you look at your Share screen, is that red? Is that green at the bottom of your computer? It
I'm
will tell
looking.
you share screen.
Yeah, it's green. All right.
Okay.
Should I
So
click
yeah,
that?
yes, click that.
Let's see.
And then it will say share.
Okay, share.
Okay.
And
Now,
then-
then you can click on the document you're gonna present.
okay. I thought I had it up on the desktop, so let me
Yeah.
just figure out where it is, because
Where it is.
I
Yeah.
went to find it before we started. So let me look. Okay, here we go.
Right.
Are you seeing it?
Yes. Is
Okay.
everybody seeing it?
Okay, so let me just get it into slideshow. I think that's what we need. Yeah, okay. Now are we good?
Is everyone able to see or hear?
Yes.
Yes.
Okay, great.
Okay, so
Thank
you
you.
should see a slide with a white background that says breaking our hearts. The number one threat to women's health is heart disease. Did everyone see that?
Yes.
Yes.
Okay, good. All right. So February is National American Heart Month. And February 4th is designated as Wear Red for women's heart health. So we're a little behind, but that's okay, because I'm very passionate about this subject, because heart disease runs in our family. And, the thing is that women tend to focus, and I'm happy now that there's attention to breast cancer. So I'm not taking away from that. But I think that we need to focus as much, if not more, attention on women's heart health as we do on breast cancer awareness, because chances are greater that a woman is going to die from some form of heart disease. So, I just want to put that in perspective, because I certainly think it's wonderful that women came out of the shadows of shame about breast cancer. And the reason I know this is my dear grandmother, who was an old-fashioned country woman. She couldn't even say the word breast, which is, kind of funny to me, because she nursed all four of her children. But she could never say that word. You know what she would do? She'd refer to these as her lungs, her lungs. But she never had a mammogram in her life. I think she would have been too embarrassed. So I'm glad that that sort of embarrassment about breast health is in the past. But I think we have to really emphasize that women also need to be proactive about their heart health. So that's why I talk about this issue. So the reality is that women will die from heart disease far more than all cancers combined. And that includes breast cancer, uterine cancer, cervical cancer, colorectal cancer. Yes, but yet less than half of women recognize that heart disease is likely to be what causes their demise. And then the other problem is that heart disease does not have a typical, the same kind of picture that we have of heart disease really comes from men. So, men will have heart pain, angina is the medical term. Women don't always have that. So 2/3 almost 2/3 of the women who die suddenly of heart disease don't seem to have previous symptoms or any knowledge that they're at risk. So what are the risk factors? And so a lot of these coincide with what are risk factors for men. So some of this is familiar to you. Age, as you get older, your risk goes up. Family history. So, I'm ticking off a lot of these because I meet age, I got the family history. High blood pressure, not so much for me personally, but I do know that women have high blood pressure. If you have diabetes or pre-diabetes, that's another risk factor. Unfortunately, if you're a person of color, whether you're a Latina or African American, that puts you at greater risk. A diet that's high in fat. So if you've eaten a lot of processed meats, those tend to be high fat. That's your sausage, bacon, hot dogs, lunch meat, tobacco use, overweight or obese, physical inactivity. So, you don't have to have all of these. In fact, I'm going to talk about my first cousin who really, other than having the age in the family history, didn't seem to have any of these others. And she had a very dramatic event. So let's talk about high blood pressure because it is so strongly linked to heart disease, to either heart attacks or stroke. And this is just, this is probably familiar. I'm not going to dwell on this because, first of all, you can read, and secondly, it's out there. One of the issues, though, and you'll see that to the right, is that every 20-point increase in your systolic blood pressure, systolic is the upper number. The way I can remember it is superior. So that means it's on top. That's the top number. So your systolic, if it increases, it doubles the risk of death. So that's one reason, not that the diastolic is ignored, but the systolic, the top number, is something that you want to pay attention to. Okay. So, a lot of people have high blood pressure. It's almost half of adult Americans. And the Healthy People goal in public health, there's sort of a guide for best practice, and it's called Healthy People. So every decade we have certain goals. So like Healthy People, let's say Healthy People 1990 focused on reducing tobacco use. And we've made some movement towards those targets. So there's always targets that we're looking at. And in Healthy People 2030, we want to increase the percentage of people who do have hypertension. We want to increase that control because we have medications. We know more about high blood pressure. This isn't what it was for like my great-grandmother. We know that a certain lifestyle is going to help with controlling your blood pressure. And it's not just medications, it's being physically active. And that doesn't mean you have to run out and join a gym, but just, walking every day, incorporating physical activity into your daily life. I mean, my grandmother, the daughter of my great-grandmother, she did that. She was very active. She was a gardener until very late in her life. So she was always busy. She cleaned houses, so forth. Yeah. So any of those things help. So, and then you see below, these are the standard things, even losing a little bit of weight. My grandmother was a big woman. She was not skinny, but she was muscle. Alcohol consumption, a lot of people are not aware that drinking alcohol increases your blood pressure. If you're prone to high blood pressure, you really need to seriously think about dialing back how much alcohol you drink or just abstaining altogether. And my brother, when he was younger and he drank more frequently and more heavily, his blood pressure was up. And then when he stopped drinking, his blood pressure went back into the normal range. So, and he didn't change anything else. Right? He didn't change his diet or sodium intake, but just, staying away from alcohol made a difference. So we already talked about the fact that about half of adults in the United States have high blood pressure. And high blood pressure is called the silent killer because often people they feel fine. They don't seem to have any symptoms. They don't really start becoming what we call symptomatic until their blood pressure is scary high. But the problem is, even when your blood pressure is elevated, but not like at the point where you're gonna, have a stroke, that chronically high blood pressure, that takes a toll on your cardiovascular system. That's why it's important to get blood pressure under control. And it's very true for women. So if you don't know what blood pressure is, it's the force of the blood against your artery walls. And it does fluctuate throughout the day. Obviously, if you've received some upsetting news, like, hello, when I woke up that Friday morning and my husband told me that the bridge that I often took between Wilkinsburg and Squirrel Hill had fallen, I know my blood pressure was up that morning because I just was stunned. Zita and I worked together in Wilkinsburg, and I took that bridge every day after work to go into Squirrel Hill to exercise at the Jewish Community Center. So yeah, I know my blood pressure was up that morning because that was kind of alarming. So alarming news, that kind of thing. Stress, yeah. So we talked a little bit about this, so I'm not going to belabor this. We talked about systolic, we talked about diastolic, so we'll just go on. So I mentioned that generally when the blood pressure is elevated, you're not always having symptoms, but when you get into what we in the medical field call a hypertensive crisis, you are going to start having symptoms, possibly headaches, nosebleeds, you might be short of breath, you might feel dizzy, anxious. You feel something like that, call 911. A lot of people don't want to call 911, and we'll talk about this because this is not just true of a hypertensive crisis, but it's true for a heart attack or stroke. They feel like, I'm not going to call 911 because I don't want to look like a fool if nothing's wrong. Trust me, call 911. Better to err on the side of caution. Nobody is going to give you a big shaming if it turns out that it isn't, medical. So this is what happens when high blood pressure is not managed well. Sometimes what happens with people is they get kidney damage. Maybe they don't have a stroke or they don't have a heart attack, but they end up losing kidney function. Vision loss. For guys, this is what I tell guys, sorry, if you don't take care of your blood pressure, because a lot of them don't want to take their blood pressure medications because it interferes with their functioning below the waist. I always tell them, well, guess what? If you don't take care of your blood pressure, I can guarantee you things aren't going to be happy below the waist. So these are what we want to avoid, because this all can be prevented now. This is preventable disease now. This is not 150 years ago when there wasn't anything we could do for people with high blood pressure. So this is where diabetes and high blood pressure, I consider them the evil twins. 60% of people who have diabetes also have high blood pressure. And you put those two things together and you're really high risk for either a stroke or a heart attack. So I would say to someone who has diabetes and high blood pressure, wow, it is worth doing whatever you can to keep both conditions well managed. And I know it's a lot of work, but the payoff is important. So I think a lot of people know this. A heart attack occurs when blood flow to a part of the heart is blocked, often by a blood clot. So, you know, as we age, our arteries get a buildup of fats and cholesterol and calcium. It's like this kind of nasty gunk that just kind of lines your arteries. And a lot of times we can live like that. But if there's a problem, like with a clot or something happens, a spasm of the blood vessel, it's not even necessarily a clot, just the blood vessel spasms, then blood supply, because you've got all that gunk inside, it's cut off. So I'm going to talk a little bit, right here's a good time to talk about the experience of my cousin, because this just shows you why women have to take the heart disease seriously. Now, my cousin, I practically make two of her, okay? She's a very petite, very small woman. I mean, her back is probably from, if you look at her from the back, you think she's a 12-year-old girl. She's very tiny. She does not have an inch to pinch. She's not a heavy drinker. She doesn't use tobacco. She exercises regularly. She gardens. I mean, she is the picture of health. Like, you would look at her and you would think, she'd never have a heart attack. Well, when she was 60 years old, now she lives in a townhouse on the north side, a stone's throw from Allegheny General Hospital. And that's probably what saved her life. So one morning she gets up, she's starting to exercise, and she just feels this immense pressure, not pain, but pressure. And she thinks it's indigestion. She takes some Tums. It doesn't go away. Her daughter, fortunately, was around and became concerned and said, I think you need to do something, Mom. No, denial. Women, particularly more than men, although men can do this too, deny the symptoms. So she was denying it. So what happened is she started to lose consciousness in her daughter's arms. So because she's so close to AGH, they called 911. Well, you know, the paramedic was right there. Boom, got her in. They went in and found that her left anterior descending. Has anyone heard of the Widowmaker? Ask a question here.
Yes.
Okay. All right. That's kind of a relic of sexism in the medical field, because in this case, it was the widower maker, because she would have, if they hadn't been that close to AGH, she would have died. You know, if they had tried to take her to Shadyside or UPMC. So that left anterior descending, which is the most important artery, was like 95% blocked. I don't understand it, because she had gone and had blood work done, and her blood work never indicated that her cholesterol was sky high. That's why I mentioned spasm. They think in some cases there's a spasm. It's not a clot, it's a spasm. And in those cases, sometimes it can be an artery that's not particularly gunked up, but whatever, it was blocked. So they stented her. And 60 years old. The whole family was completely shocked, because, you know, you would look at her and just think she was the picture of health. So this is basically what happens. So if sometimes it'll be a double thing, it'll be a piece of gunk combines with the blood clot. So there's a lot of things that can happen. But what you need is to get that artery reopened, because when the muscle dies, the result is permanent heart damage. And in the case of the left anterior descending, it's almost those are the heart attacks that take people out. And family history, actually, that is how people die of heart attacks on that side of the family. They have a heart attack, and within 15 minutes, they're dead. So we must, I talked with my cousin about this, we must be prone to some issue in that left anterior descending, because on that side of the family, it's the Irish side. On that side of the family, they get a heart attack, it just, that's it. So, but anyway, I could talk a little bit about my mother here. Now, Tony, my cousin, other than having the indigestion that's listed here and maybe some pressure, to her, it wasn't pain. And, you know, I've often thought about this. I'd be interested in hearing what other people think. I think why women don't have the same kinds of signs and symptoms that men have is, I think Mother Nature gave us a higher, not all women, but a lot of us, a higher threshold for pain because we go through childbirth. You know, is there any, can I prove that? That's just my supposition. But anyway, in my mother's case, what happened with my mother is that she experienced extreme fatigue, an extreme shortness of breath. She really did not experience indigestion or chest pain, but she felt very weak and very short of breath. And the only reason, my mother always tended to minimize any of her pain or discomfort all her life. She was always very stoic. But I told this to Zita, the only reason my mother kind of took action was because I had given her a book a while back that was titled What Nurses Know and Doctors Won't Tell You or Don't Tell You or something. Sorry, I'm not trying to put doctors under the bus, but sometimes this does happen. Well, she read that book, and apparently there was a whole section on kind of, you know, you need to know these symptoms of heart attacks because it's not always the classic elephant sitting on your chest feeling. So she was outside doing something, and then she came in the house and told my father to drive her to the doctor's office. The doctor listened to her heart, probably ran an EKG, and they immediately took her to the medical center and stented her. And guess what? It was her left anterior descending, the widower maker. So that's my, oh, here's what saved her life, because the distance was great between the farm and the medical center. The first thing she did, because it said in that book, if you feel these symptoms, chew a regular aspirin. That's what she did. She always had aspirin in the house, and she chewed an aspirin. And that's probably what saved her life. So, you know, I know this has happened with some other women I know. They get the shortness of breath. A lot of times it's nausea and vomiting, or they break out in a cold sweat, or they feel lightheaded or dizzy. So, or the pain is not in the chest, but it seems to refer. It's referred pain. It might be in the back or the shoulder or the neck or the jaw. So some women do experience the kind of pain that we associate with male heart attacks, which is the the just unrelenting pressure in the chest. But if my mother hadn't read that book, she would have just thought, oh, well, I guess I'm not feeling good. I'll lay down. But she didn't do that. And that saved her life. So these are the things women need to know. So only 53% of women said they would call 911 if they were experiencing those symptoms, those kind of, not so dramatic symptoms. But this is typical of women. 79% said that they would call 911 if someone they knew, like their husband, their daughter, who else was having those symptoms. So, this is what we do. We're so concerned about others, but we don't have the same concern for ourselves. So, my thing to say to everyone, not just women, but everyone, don't minimize your symptoms. Especially women will go in and minimize their symptoms, and then the initial test results are negative, and then they get patted on the head and told, oh, you're okay, and they go home, and then they die at home. Wait for, just hang around, insist that the tests be run again, because sometimes it takes, like the cardiac enzymes that they often draw when you come in. Sometimes that takes time. It's almost like, to use an expression, it's like it has to cook a little bit. It's like this happened with my brother. He went in having, in this case, it wasn't a heart attack. He went in having the symptoms of appendicitis. They ran the blood work right away. It didn't show anything. And they patted him on the head, sent him home. He went home, and then his appendix burst. So my daughter had symptoms. I took her in and I said, I don't know, but this is very unusual for her. So they waited. It's almost like they must have run the blood work, but then they went and ran it again or something. I don't know, but it took time. But they said, oh yeah, her bacteria count is up. Yeah. So, don't let them rush you. So yeah, this lipoprotein A, this ended up being what my cousin had. So it's an under-recognized risk factor. There was some physical, I forget the name. It was the guy, one of these guys that does a lot of physical activity. And again, lean, fit, muscle, boom. He had a heart attack, and that's what he had. It's not routinely tested for, but there is a genetic, it runs in families. So because my cousin found out later on she had this, she told everyone, hey, get tested for it. So I went in and told my doctor, I want to be tested for this lipoprotein A because my cousin had it. And then as it turned out, I don't have it. So I'm happy for that. Another issue with women is something called myocardial infarction with non-obstructive coronary arteries. This phenomenon is 5 times more common in women. It's twice as common in non-whites. So again, we're hearing stories, like I just read something the other day that I want to mention. It was an African-American woman, under 40, had symptoms, went in, she was kind of blown off, but she persisted, and it turned out she was having a heart attack. And I think, wow, she may have had this phenomenon called Menoka. So, we're finding more and more about heart disease because women and other groups of people don't fit that male profile. And, I'm just going to say, this is the legacy, the history of medicine. The history of medicine is, it was kind of white males were the standard. And, it's only been within the past 20 years or so that now we're starting to recognize that, not everybody fits that pattern. The other thing is that studies have indicated that female heart attack patients are much more likely to survive if they're treated by a female ER doctor rather than a male ER doctor. Sad. I hope that changes. But yeah, just because we don't present with the same, we don't have the classic picture of a heart attack. So, I think that we just don't get as much screening, therapies, fewer referrals to cardiac rehab, and I think this is going to change because, it's not like I've stumbled on this myself. I've read this has happened. So I feel confident that we're going to make changes, but we need to be aware. And that's why I'm talking about this. Stroke. This is also a big problem for women. I think I read something that more men than women have high blood pressure, but more women than men have strokes. So, again, we need to really understand that especially if we have high blood pressure and combine the evil twins, diabetes, that we're at higher risk for stroke. So, and the other scary thing is 75% of Americans under 45 cannot accurately identify a warning sign of a stroke. Now, here's the thing. You'd say, well, okay, what's the big deal? Your chances of having a stroke are greater when you're older. Well, the problem is when you're having a stroke, ditto for a heart attack, it's good for family members, community members to be able to recognize it. That's going to be key to treatment and survival. So, these are things that we want our younger family members and younger community members to know. What are these things, these signs to look for either a heart attack or a stroke? So a stroke is basically, you have a heart attack, you have a brain attack. It's cutting off flow of blood to the head. And then there are people who have transient ischemic attacks. And again, these need to be taken seriously because a person who's had a transient ischemic attack is 9 to 10 times more likely to have a stroke. So it's a medical emergency. If you have a brief period where you can't, words won't come out of your mouth or whatever, that needs follow-up. Even if it goes away and you think, well, I don't know what that was. You need to talk about it with your doctor and you need to have follow-up. And if it happens in the future, you need to go directly in, call 911, go directly in. And again, strokes are like heart disease. They're preventable, they're beatable, and they're treatable. So, 80% of strokes can be prevented through some healthy lifestyle measures. And again, we're the benefits of amazing advances in medical care because 100 years ago, you had a stroke, there wasn't a whole lot they could do. But that's one of the reasons why we want to know, because now there's treatment. So a lot of you have probably seen this FAST, F-A-S-T. So it's your face, is one side of the mouth drooping or one eye is kind of down. It's arm weakness. So you want to have the person put their arms out and hold them. And if one arm starts to drop, speech difficulty. So any one of these is a reason to call. They don't need all three. Yeah, so that's, yeah. Sometimes it'll be weakness in an extremity like the leg, double vision or blurry vision, a sudden headache that, there's no known cause for. Some people know, like if they're dehydrated, they're more prone to headaches. They know that. But if they've been well hydrated and all of a sudden they've got the headache of a lifetime, that's a red flag. Loss of balance, coordination. So why is this important? Because there's a window of time, and some of you may know this. There's now a very brief window of time where a clot busting drug called tissue plasminogen activator, TPA, can be administered and it can break up that clot. So that's why time is of the essence. And I'm going to put a plug in here for learning CPR. You know what? A lot of people are intimidated by CPR because they're like, oh my God, you have to coordinate the breathing, the breaths with the chest compressions. They now have chest compression only CPR. The American Red Cross teaches it. And you know what? It's for the average layperson, it's so much better because it's not that complicated. You don't have to put your mouth on someone else's mouth. You just start compressions. First thing, of course, is calling 911, but start compressions. You probably can go online and see a YouTube video. But I know like Pittsburgh Black Nurses in Action offers it. I mean, they did. Everything's kind of been screwed up because of COVID, but they used to offer that a lot. And, I can't say enough about the American Heart Association's website, Centers for Disease Control, the National Heart, Lung, and Blood Institute. And then this website I really like a lot, and that's womenheart.org. That's a really good website specific to the needs of women. And then there's womenshealth.gov, and then myheartsisters.org. So these are all good places to get information. And that's basically it. So I hope that we have some questions, discussion, because I think it's an important topic for people to really be aware of. And maybe because there's some really awesome people on this call, you might want to contribute to the discussion because you may have information about the topic that I don't have. I'm not professing to be an expert. I just have a lot of passion and interest in this because I've seen it unfold in my own family, both with my mother and my cousin. All right.
Thank you so much, Lorraine. That was a lot of information and it's very useful information. Can you exit down there to stop screen sharing?
Yeah.
Okay.
There, I think
All
I
right,
did it.
thank
Hooray!
you.
Hey, I'm making progress on this technology.
Thank you. Yeah. I mean, you said it all. You covered every, area. And we know as women, there are a lot of stuff that really come against us, including the challenge of life, everyday life. And we have to be careful and knowledgeable about our body and how it functions. So I'm so glad that you were able to provide us with that information. So I'm going to open it up, please. If anyone has a question, comment, anything, here is your opportunity to ask questions or make a comment. Thank you.
That was very thorough, Lorraine. And I know I came in after you began, but I know someone that chalked up a weird episode because they ate some ice cream fell asleep, then woke up with like a crushing feeling in their chest, cold sweat, dizzy, had to lay on the floor, and then just kind of gutted it out till it was over. So,
Well, that's interesting that you raise that, because, I get 50 million things coming in the mail all the time. I'm like obsessed with health. So I just got this Harvard Health letter. And one of the things, I didn't have time to talk about this, but I would, if I were this person, I would still want to, it could have just been very bad indigestion from the ice cream, but I would still want to follow that up, because they say in this newsletter, it says silent myocardial infarctions account for a shocking 45 to 50% of all heart attacks. So I'm not saying that's what happened to your friend, but I read this. I just got this, and I read this yesterday, and I thought, wow, I knew there was such a thing as silent myocardial infarctions, but that number, 45 to 50%, and it made me think about my grandfather. And so what happened with him is that he had a stroke. He had a lot of risk factors. He ate a very high fat diet. He had used tobacco. Okay. So he had a stroke. And when he went in and was evaluated for the stroke, this has been decades ago, they found damage in his heart. And they questioned him about it. And he was completely dumbfounded. But my grandmother remembered there had been a day that he hadn't felt well. That's probably what he had. He had a silent, because they said, you've had a heart attack. We can tell by the damage in your heart. So, and so this is something we all need to be aware of, both men and women. And I have to say, what is it? Doctors and nurses, we're kind of bad in terms of diagnosing ourselves. So I had a particularly rich Christmas meal one year. It was duck. I won't touch it again. And so that night I had so much burning and pressure. And I thought, oh my God, is this a heart attack? And the only reason I didn't say, hey, let's call 911 is that I kept taking my pulse, kept checking my breathing. I wasn't sweating. I wasn't nauseous. I took some Tums and I finally was able to go to sleep. But if I'd had nausea or cold sweat, I probably, because I know those symptoms are, they're not good symptoms. So I'm glad your friend is okay, but I would really urge, is female, I'd really urge her to go have a workup done.
yeah.
Because you don't know, it could have been a silent.
So people, so they can see if there had been.
Yes, they can see.
Previous episode.
Yes.
Yikes. Okay.
And that's important to know, because then they can, start figuring out what's the appropriate medication treatment. It may have just been indigestion, but personally, I would want to check that out. In my case, I ended up going to the doctor and I had a workup done, and it was indigestion. But that doesn't mean that sometime in the future it won't be a heart attack, because I do know my family history. So, and I was debating with myself as I'm taking my pulse. I'm like, you should just go call 911. I'm like, well, my pulse is regular. I know I shouldn't do that, but I did. That's a little, but if I'd had a cold sweat, I would have been calling, because that's, well, as a nurse, when I was in the hospital taking care of people, if I saw them getting, we use the medical term diaphoretic, I think. Anytime I saw someone getting clammy, right away, red flags are waving. I'm like, okay, something's going on here. I don't like it. It's either their blood sugar, their heart, something's wrong.
Okay.
So,
Yeah, not good, not normal,
good.
not something you just
Not
blow
good.
off.
No, no. Normally, you don't break out in a cold sweat unless something's happening. That's,
And
I think
especially
you hit the
for women, there's a lot that we really need to pay attention to. So when you have some of those symptoms, you really have to speak up or act. And Lorraine says something about don't let them rush you. But I want to add to it, don't rush yourself either.
yes.
Because some people will get in there, the doctor comes and they say, there's nothing wrong with you. Oh, yeah, okay, that's fine, I'm leaving. The thing is, you're not rushing to anywhere. Just make sure that you're being taken care of to the point that you're satisfied. And a lot of what is going on these days is that with all of other stuff going on in our world, you get into the ER, they want you as fast as you get in to get out. So you just have to be your own advocate. You're going to make sure that you're okay before you leave that ER. I don't care how long you stay there. It is your health. Always remember, you are responsible for your health. And
Right.
you must advocate for yourself, especially women. I'm
Right.
not saying that guys won't, because sometimes when they see men, everybody pays attention more, and I don't know why, but I'm just saying that happens because I've been there and done that. Really, there are, I mean, some of them you just look at them, you got to give everything without them even asking. But for women, for who we are and how we carry on, and even how we take ourselves, we miss it sometimes. So please be your own advocate.
I guess
And I would add, if a lot of times you're better off, especially if you're having symptoms and you're not feeling good, see if you can get someone to come with you, because when you're not feeling good and you're in the throes of something, whether it's like, I'll use my brother as an example. He was in the throes of appendicitis and he had his wife, who's a registered nurse, with him. But what can I say? She's me, I don't really care if people think I'm a jerk. I'm just going to be emphatic. But she backed off and, didn't persist, took him home. And then, of course, it got worse. Me, I'm like, I'm not there for a popularity contest. Hello, I'll be polite, but I'm going to stand my ground. And I would say that's what you have to do, unfortunately. If you're not getting what you feel is satisfactory, if you're not being taken seriously, if you or your loved one is not being taken seriously, yeah, I just say, I'm respectful. I understand. I'm a nurse. I get it. They're overworked. They're under a lot of stress. But by the same token, too many women, and I didn't want to go dwell on this because it gets depressing, but too many women haven't been taken seriously with their heart symptoms. They go home, they have a heart attack. By the time the family gets them back to the hospital or they call the paramedics, they're gone. So anyway, go ahead.
Dorothy, you want?
Well, Zita knows my situation. So, but I just want to share that I appreciate your sharing and reiterate everything you said, because in November, I ended up with not only the blood clots in the leg, but also the lung and blockage to the heart. So, so I've been going through a lot of what you've already, talked about, and I would just encourage other people. I did not have chest pain. I did have, what got me moving was the shortness of breath. Okay. That was the only symptom I had. I had no chest pain. Now, for weeks, and I probably had the blood clots, my leg was swelling more than usual. And I was blaming it on too much sodium, too much this, too much that. I should have probably gone a couple weeks before I went. But thank heavens I had a nurse who went with me, and they admitted me, even though the emergency room was filled. When they knew my symptoms, they took me immediately. I ended up in intensive care for 5 days, but the
Oh,
care was
wow.
wonderful. The care was wonderful. And I have an appointment in 10 days to see my PCP. So
Oh, good,
I'm
good,
doing
good.
better.
Well, I'm so
Yeah.
glad you had an advocate with you. So
Yeah.
glad.
Yeah, I did have an advocate, a nurse advocate. So
That's
And
great.
Thank you.
that's really wonderful. And the other thing also why we encourage people to do that early intervention is that actually I don't want to say that we're all focused financially, but that's also part of it. So the earlier you get in, the less expensive it gets. But if you wait until you're almost, we're dealing with a whole lot, so we're trying to save your life. Of course, it's expensive at that time, at that point, so you want to actually, and then of course, the whole family stress and stuff like that is kind of exaggerated. And that impacts other people's health as well, including the person. It might even worsen because the person might be thinking, oh my gosh, am I dying now that I'm going to the intensive care unit,
Mhm.
So yeah, very important. Just be safe. Rather be safe than sorry. You go
right.
there and they say there's nothing wrong with you. Are you sure? I'm still not feeling well. Please double check because I don't want to leave here until I'm really, satisfied. And nobody can take that right away from you. No, they can't get upset. That's fine. Everybody gets upset once in a while. But remember, it's your life. So you got to be the one who should advocate or someone with you. Like Lorraine rightly said, please, when you're not feeling well, if you know somebody, you can even call. You can call someone, even if they're not physically present. They can always communicate to the care providers via phone. Thank God for all this social media. We have all kinds of technology now. They can
Right.
do FaceTime, they can do Zoom, they can do anything and everything
Right.
to save people's lives. So please take it seriously because life has no duplicate.
That's for sure. And I really have to underscore what Zita said. Even if they can't physically be there, that's so important to get them on the phone and have them ask questions of the nurses and doctors, and maybe things that you're not thinking of. But a fresh pair of eyes, an extra pair of eyes, can maybe spot something. And FaceTime is fabulous. So yeah, you can do that, assuming you've got a smartphone. Some people don't have that kind of phone, but
Yeah, but whatever
a
you
lot
have,
of us do, and we
do
should
have.
take
Yeah.
advantage of it. So that's an example where technology can be helpful.
Right. Or know somebody that does. That's what networking's all about, right, girls?
That's
Right,
right.
right.
That's right. That's right.
So true. And the other thing, it really bothers me with the statistics research is providing us now, especially for pregnant women. And we are talking about women, younger folks, like Lorraine pointed out earlier. They are having this whole incident now is becoming more rampant. Pregnant women are having some of this, and I'm like, oh my gosh, what's going on? So we think about all kinds of diet that people are on, the level of stress young people are being exposed to right now, and of course, the kind of medications, self-medication, and other risky behaviors. And all of that, once people get pregnant, including the pressure of pregnancy, the whole thing is kind of exaggerated. And they're having outcomes that is unheard of. So
Right.
please, if you know nieces and nephews, sisters, brothers, just let them know and be aware. When a woman is complaining, please listen. And we encourage the women, please share how you feel. Women are known not to really be expressive.
Right.
Once it comes to healthcare, please don't take things for granted anymore.
Right. Well,
Because our world has
right. I
changed.
have to say, this is true. My mother was always minimized all her symptoms. She was always very stoic. So yeah, this is a woman who gave birth naturally back in an era when that was not done. So she could, the doctor couldn't believe that she didn't want any medication when she had me back in the 50s, because they routinely knocked women out back then. And she said, no, I don't want that. And he couldn't believe it. But yeah, but then the downside of that is when it came time for something serious, she tended not to take it. She didn't want, it's like, oh, I don't want people to fuss over me, but
I think what you just said now reminded me, my mom passed away 2 years ago, and she was the vocal type. So we went to the doctor and they asked her, wanted to know what was going on. The doctor asked her to describe the pain. And I remember it because you talked about the labor pain. And my mom said, oh, that pain, felt like the labor pain when she was giving birth. And the doctor said, oh my God, really? She said, yes. So they went into doing more investigations, and here they found out that she had issues.
Yeah,
she did have. So it was her description, and it was what you just said. She said, when that happened, I'm like, I'm not in labor, so why am I having this kind of pain?
But she
So that
knew
was the
she
description.
dealt with that, right? So she experienced it and she came on the other side of it.
Exactly.
Exactly.
So
but when you're in labor,
that's
you're having a
kit,
baby,
right?
you expect to have the pain. When you're not having a baby, you're like, what's all this pain
What
about?
is this about, right?
Yeah, right. There's no prize at the end. At least they hand you a cute baby at some point. You're like,
right.
winning. Oh my goodness. This is so nice. This is my first time here. I've been wanting to get here for a while. So
thank you. I'm
thanks for
glad
letting
to
me come.
have you,
Nice
Caroline.
to see y'all. Yeah.
Yeah,
Oh,
thank
rocking
you
it.
all for coming. This is wonderful, very educative information that we can use. Every single one of us, if you're able to share with another person, one or two people more, that's how we save life. That's what we're here for. And I am actually advocating for women because I know what is good for a woman is probably good for everybody.
That's right. That's absolutely true, because
the hand that rocks the cradle, girl.
Well, it is actually, I forget who said it, but someone said, you can tell how advanced a civilization is by how the women are treated and regarded.
Yes.
If women are disdained, if they're not valued, then that society is not going to progress.
Interesting.
Yeah.
A friend of mine started like a outreach, and she's an orthopedic surgeon, like top in the world orthopedic surgeon. And they go into third world countries. And she said, we heal the women, we heal the village.
Yes, that's right. That's absolutely correct.
Yep.
That is true. So, yeah.
So
well,
please,
I really appreciate the fact that you guys were so patient. I know I went over material that maybe you're aware of, but I never take anything for granted. So I always like to review the basics and so forth. But yeah, I highly recommend that you look at the websites that I mentioned. I'm trying to remember. Womenheart.org is one I really liked a lot. But American Heart Association also has a lot of very good stuff.
Yeah. They also Healthy People 2020.
2030 actually.
Well, now 2030. Yeah, they all have very useful information that can really help women and everybody else become healthy. please visit our podcast, our website, and we weekly we advertise who is going to speak, be our guest. So for next week, we will be having someone talk about, I'm trying to get her name right here. She is going to be talking to us about politics, and our world. So I'm just, I'm so excited, and I look forward to having her, and trying to bear with me here. I'm trying to get her name. And so come prepared and to listen to her, and we will also be putting up the we'll be putting it up on our website and on our, so that's Amber Thompson. Amber Thompson. I don't know if any of you know her. She is really well informed, well educated in the issue of women, and she will be really giving us some information that will be very valuable too. How we present ourselves and how we need to be as women in this whole culture. And I'm looking forward to having her here, and I'm looking forward to having all of you here listen as we have listened to Lorraine today. And Lorraine, thank you so much.
Oh,
And
you're welcome.
You're gonna
It's my
be coming
pleasure.
back. You're gonna be
Thank
coming
you.
back.
Well, anyway, just want to say something about policy. Policy definitely affects women's health because I'm old enough to remember that much of what happened with breast cancer had to really be, let's say, there had to be a lot of advocacy and agitation and policy change, because at one point, the insurance companies were basically trying to have women have basically drive-through mastectomies. They were trying for breast cancer. If you needed a mastectomy, they were basically wanting to just have you come in that morning, have the surgery, and they were going to discharge you. You weren't going to get an overnight stay. Hence the name drive-through. And they had to force the insurance companies to change that. They had to agitate and lobby and go to Harrisburg and get that changed. Otherwise, that's what we would have. We would have drive-through mastectomies, drive-through childbirth, whatever. I'm just saying that's policy's very key to our health issues, and not just for women, but for a lot of us, especially people who are vulnerable. I mean, this is an issue that impacts women who don't, or families who don't have means. Obviously, if you're wealthy, you can afford, okay, so your insurance only pays for you to go in and have the surgery and leave. Well, you have the resources, you have the money that you can afford to stay overnight. It's people like us who don't have that kind of money. We have to have insurance policies.
Yeah, we have policies because of people like us. If everybody's rich, there won't be any need for policies. So.
Yeah, right. Yeah. So anyway, well, I don't want to take any more time. Thank you so much.
Yeah,
I think I'm going to go ahead and leave now. So
you don't think the prostate exam should be exactly the same as a mammogram?
Listen. You don't get me started, but mammograms. I'm like, if men had to go through this, they would come up with something else.
It was a friend of mine that said if men had to have their prostate checked like the way the women have to have their breast checked.
I know. And you know what? Every year I go in and I really hate it because it's painful. When they say hold your breath, I'm thinking, you don't have to tell me to hold my breath because
I'm gonna hold your breath.
holding it anyway because this hurts. But
Hannah has something to contribute here.
Okay, Hannah.
I'm sorry. I just, Carolyn, can I ask you one question?
Yes, ma'am.
Okay. Oh, not Carolyn. I'm sorry.
Lorraine.
Good. Thank goodness, because I did not study for this test, Miss Hannah.
No, I'm sorry. The speaker. I just wanted to ask. I'm sorry.
Lorraine. Yeah.
Can I just ask you one question, Lorraine?
sure.
Okay. My daughter has the BRCA gene.
Yes.
So she did everything prophylactic.
Yes.
This was a couple of years ago. What do you think about this? Now everyone is testing for BRCA. I don't have it. My husband's family had it. Arthur had
Right.
cancer. What do you think about this? Because people without the gene are getting cancer.
Well, now that's true. And here's the thing. I have to say, if I were your daughter and I knew I had the BRCA gene, I would probably want to be proactive. I would probably, this is an individual decision. The medical community is not united on this. But if I had that gene, and especially in my case where I am done with childbearing, I am done with nursing, I would probably go to the doctor and say, you know what, please remove my breasts, please remove my ovaries. I'm done with them. I just would, because I just feel like, that feeling that you almost like have a gun pointed at your head. But every woman is different. Some women with that gene might not want to have their breasts or ovaries removed, and I respect that. But personally, I would do it because I just feel like mine have served their purpose. Thank you very much.
Yeah.
But,
Well, my daughter had it done. She was in her, God, she should live and be well. She was about 43, 44. She had the kids. She had everything done and the reconstruction.
Right.
But that's, and my niece was urging her because she has BRCA. It's in my husband's family. So, but she's on a website. There's a lot of women there that have the BRCA that won't do.
Right. And I understand that, because a lot of women feel that that's disfiguring. And I get it. We all feel differently about our bodies. It's like some women absolutely refuse to have any kind of cosmetic surgery. And then there's others who go the other extreme.
Yeah.
So,
Right.
what is good for me may not be good for you. But
Right.
I have given some thought to it. And your point's very well taken. Just because you don't have the BRCA gene does not mean you are not at risk for cancer. And I'm going to probably put something out there that's probably going to stir up a hornet's nest. But
No.
I think that the reason we're seeing so much more cancer, especially breast cancer, is because we live in a world that's basically a chemical stew.
Mhm.
Okay, I think about my grandmother. My grandmother was a country woman.
Mhm.
Everything that went into her mouth was something that she either raised, her chickens, or she grew in her garden and she cooked it herself. She never bought processed food. What little bit of furniture she had in that house was solid wood. It was not compressed with glues and formaldehyde. What few carpets she had in that house were 100% wool. So, she never dyed her hair. She never painted her nails. She never, she just really never was exposed to any. She lived out in the country, so she wasn't exposed to the nasty pollution here in Pittsburgh. So, the water she drank,
Order.
the air she breathed, the food she ate, it was all pretty pure.
Yeah, absolutely.
And now, as her granddaughter, I can't say that, because I have had things that I've eaten that I know weren't pure. I've been in environments, offices where the furniture was not solid wood.
Yeah,
The carpeting, when you put down new carpeting and it smells, that's chemicals. You put down a wool carpet, it doesn't smell. So that new car smell, that's the same thing. It's the off-gassing of chemicals. And we're absorbing that. We absorb it through our skin. We absorb it through our nose and our mouth. So we're living in a world where there's all this, everything is chemicals.
right.
Plastic, she had no plastic. Everything in her house was either glass or a crock.
Yep.
She had no plastic.
No.
So yeah, I'm not saying we want to go back to that, but we need to be wiser about what choices are we making. Like,
Right.
I won't have carpeting in my house anymore
Yeah.
unless I can get 100% wool, which
Right.
is expensive.
Yeah.
But
Right.
yeah, there's just certain things I'm not going to have.
Right.
Yeah,
Right.
and it's good for women to be aware of this, because guess what? We are the ones that are being exposed, like every other person with all of this stuff, but we have the more the tendencies of grabbing other stuff and putting to our body, like
Right.
from your head to your toe.
Right.
Just
In
think
fact,
about
you
it.
know what? Here's a good suggestion for a speaker. Women for a Healthy Environment. I recommend them very highly because they will talk about this, how, we need to be aware. We need to be aware on a personal level, but then we also, going back to policy and politics, we need to engage in changing policy. Because one thing that irks me is like personal care products, whether it's lotion for your skin, whatever. I always thought that was regulated. It's not.
No.
It's the wild, wild west out there.
Right.
So
Right.
you can put stuff on your skin and think it's okay, and then come to find out it's full of chemicals that are known to be endocrine disruptors. Hello, no wonder we're having higher rates of breast cancer.
Right.
We're putting stuff on our skin, we're absorbing it, and it's an endocrine disruptor. Duh. Anyway, I could just rant and rave all night, but I'll leave you because people have to go to the bathroom.
All right. Thank you so much, everyone, for attending. Lorraine, this is fabulous. I really enjoyed your presentation and your sharing and all that. And,
All right. Well, thank you, everyone. I'm going to
you're
leave
welcome.
now.
Yeah,
Bye.
we're all leaving. So thank you, everyone. Please, next week, let's make it again and contribute. Make your contribution, ask questions. Feel free. This is a friendly platform that I want everybody to feel at home and open up and share. Thank you all for coming. Have a blessed night.
You do a great job, Zita. All right, I'm hosting a bunch of people at the house next Tuesday. I actually said, y'all should get on this podcast, but whatever. I don't think they are. So I'm going to miss y'all, but I'll jump back in again.
Sure. Thank you so much, dear. All right.
Good job, y'all.
Bye-bye. Good night, everyone. Bye.
Night, Zita. Bye.
All right. Good night, Hannah. Thanks for coming.
I'll see you.
Thank
Very
you,
good.
Annalie, for coming. Thank you
Thank
all.
you. Wonderful
Thank you, Sarah.
presentation.
Thank
Wonderful.
you, Denise.